The human heart is a remarkable organ, a muscular pump working tirelessly at the center of your circulatory system. Its primary job, its entire reason for being, is to keep blood moving throughout your body. Imagine it as a sophisticated dual-action pump. One side of the heart receives deoxygenated blood, which is blood that has already delivered its vital supplies to your tissues and is returning for a refill. This blood is then pushed directly to the lungs. It is a continuous rhythmic cycle, a foundational process that sustains every single one of your body's functions, from thinking to moving. This constant flow is what we recognize as our pulse, a tangible sign of life itself. Once in the lungs, a crucial exchange takes place. The deoxygenated blood releases carbon dioxide, a waste product from our body's metabolic processes, and picks up a fresh supply of oxygen from the air we breathe. This newly oxygenated bright red blood then travels back to the other side of the heart. This side is stronger, built to handle the immense task of propelling this life-giving fluid to every corner of your body. From the tips of your toes to the highest reaches of your brain, no cell is left untouched. The heart's chambers, known as atria and ventricles, contract and relax in a perfect, coordinated sequence to make this happen. A process medically termed the cardiac cycle. This oxygen-rich blood does more than just carry life-sustaining air. It is also a delivery service for essential nutrients, hormones, and other compounds that your cells need to function, grow, and repair themselves. Think of the blood vessels, the arteries, veins, and capillaries, as an intricate network of highways and local roads. The heart is the central dispatch, ensuring that these crucial supplies reach their destinations efficiently. The arteries carry the oxygenated blood away from the heart, branching into smaller and smaller vessels to reach every tissue. This constant supply of fuel is what allows your muscles to contract, your brain to process information, and your organs to perform their specific duties without interruption. Simultaneously, as the blood delivers its precious cargo, it also performs a vital cleanup service. It picks up waste products such as carbon dioxide and lactic acid from the cells. This deoxygenated blood then begins its journey back to the heart through the veins, completing the circuit. The heart then sends it back to the lungs to get rid of the waste and pick up more oxygen, starting the entire life-sustaining loop all over again. This elegant, unceasing process happens about 100,000 times a day, a testament to the heart's incredible endurance and its central role as the lifeline of the human body, a relentless engine powering our existence from our first breath to our last. The term heart disease is not a single diagnosis, but an umbrella term that covers a wide range of conditions affecting this vital organ. These conditions can disrupt the heart's normal, efficient operation in various ways. One of the most common types is coronary artery disease, where the arteries supplying blood to the heart muscle itself become narrowed or blocked by plaques, a buildup of fat, cholesterol, and other substances. This can lead to chest pain, known as angina, or a full-blown heart attack, medically called a myocardial infarction. Other conditions include problems with the heart's rhythm, called arrhythmias, and issues with the heart valves that control blood flow between the chambers. Heart failure is a specific and serious condition that can result from various forms of heart disease. It does not mean the heart has suddenly stopped working, but rather that it has become too weak or too stiff to pump blood effectively enough to meet the body's needs. Imagine an engine that has lost some of its power. It still runs, but it struggles to get the car up a hill. Similarly, a failing heart struggles to circulate blood, which can cause symptoms like fatigue, shortness of breath, and fluid buildup in the legs, ankles, and even the lungs. This condition can develop gradually over many years, or appear more suddenly after a heart attack has damaged the heart muscle. The causes behind these heart problems are often multifaceted, blending lifestyle choices with factors beyond our control. Unhealthy dietary habits, particularly those high in saturated fats, trans fats, cholesterol, and sodium, are major contributors to the plaque buildup that clogs arteries. A sedentary lifestyle, one with little to no regular physical activity, weakens the heart muscle and contributes to other risk factors like obesity and high blood pressure. Smoking is exceptionally damaging, as the chemicals in tobacco can harm the blood vessels, reduce the oxygen in the blood, and raise blood pressure, creating a perfect storm for cardiac events. Beyond these lifestyle factors, genetics and family history can also play a significant role. If your parents or siblings developed heart disease at an early age, your own risk may be elevated. Conditions like high blood pressure, hypertension, and high cholesterol can also run in families, predisposing individuals to heart trouble. Additionally, other chronic conditions such as diabetes significantly increase the risk of developing heart disease. Understanding these causes is the first critical step in recognizing personal risk and taking proactive measures to protect the health of your body's most important engine before it begins to falter. The good news is that a significant portion of heart disease is preventable. Building a blueprint for a healthy heart revolves around making conscious, positive choices in your daily life. The cornerstone of this prevention strategy is nutrition. A heart-healthy diet emphasizes fruits, vegetables, whole grains, lean proteins like fish and poultry, and healthy fats found in nuts, seeds, and olive oil. It is equally important to limit the intake of processed foods, sugary drinks, and red meats, which are often high in the unhealthy fats and sodium that contribute to high blood pressure and clogged arteries. Think of your diet as the quality fuel you provide for your body's engine. Regular physical activity is another non-negotiable component of heart health. Your heart is a muscle, and just like any other muscle, it gets stronger with exercise. Aim for at least 150 minutes of moderate-intensity aerobic activity, such as brisk walking, swimming, or cycling each week. This helps maintain a healthy weight, lowers blood pressure, improves cholesterol levels, and reduces overall stress on the heart. Exercise also improves circulation, ensuring that your entire body receives the oxygen-rich blood it needs to thrive. It's not about becoming a marathon runner overnight. It's about incorporating consistent movement into your routine for long-term benefits. Abstaining from smoking is one of the single most impactful decisions you can make for your heart. Smoking is a direct assault on your cardiovascular system. It damages the lining of your arteries, making them susceptible to plaque buildup, and it thickens the blood, making it more likely to clot. Quitting smoking allows your body to begin healing almost immediately. Within a year of quitting, your risk of a heart attack drops dramatically. If you don't smoke, never start. If you do, seeking help to quit is a powerful investment in your future health, extending not just the length but also the quality of your life. Finally, proactive monitoring through regular medical checkups is essential. These visits allow a doctor to track key indicators of heart health, such as your blood pressure, cholesterol levels, and blood sugar. These numbers provide a clear picture of your cardiovascular risk and can catch potential problems early, often before you even notice any symptoms. Early detection allows for early intervention, which is far more effective than trying to manage a disease that has already progressed. Think of these checkups as routine maintenance for your heart, ensuring it continues to run smoothly for years to come, and keeping you informed and in control of your health. When prevention is not enough, or when heart disease has already developed, modern medicine offers a robust arsenal of treatments to manage conditions and restore quality of life. For many patients, the first line of defense is medication. There are various classes of drugs designed to tackle specific problems. For instance, statins are prescribed to lower bad cholesterol levels. Beta blockers help lower blood pressure and reduce the heart's workload. And ACE inhibitors relax blood vessels to improve blood flow. For those with heart failure, diuretics may be used to reduce fluid buildup. These medications are often a long-term commitment, working quietly to control risk factors and prevent future cardiac events. In more advanced cases, or when medication and lifestyle changes are insufficient, surgical interventions may be necessary. Procedures like angioplasty and stenting are common for clearing blocked arteries. During an angioplasty, a tiny balloon is inflated inside the narrowed artery to push the plaque against the artery walls. And a small mesh tube, called a stent, is often left in place to keep the artery open. For more severe blockages, coronary artery bypass surgery may be performed. This procedure creates a new path for blood to flow to the heart muscle by grafting a healthy blood vessel from another part of the body to bypass the blocked section of the coronary artery. It is crucial to understand that treatment is rarely just one thing. It is a comprehensive approach that almost always includes significant lifestyle modifications. Even after a successful surgery or while on medication, adopting a heart-healthy diet, engaging in regular physician-approved exercise, and quitting smoking are fundamental to long-term success. These changes help the medical treatments work more effectively and reduce the risk of future complications. Lifestyle changes are not just a recommendation. They are an active and essential part of the treatment plan, empowering the patient to take a central role in their own recovery and ongoing wellness. Ultimately, the most important message is one of vigilance and partnership with a medical professional. Your heart is too important to leave to chance or self-diagnosis. If you experience symptoms like chest pain, shortness of breath, dizziness, or unusual fatigue, or if you simply have concerns about your risk factors, do not hesitate. The best course of action is always to consult a doctor. They can provide an accurate diagnosis, explain your options clearly, and create a personalized treatment plan. Your doctor is your most valuable ally in the journey to protect and manage your heart health. Never delay seeking help. It is the most critical step you can take.